Neily on Nutrition. I'm with Catherine Fink. She is a registered dietitian specializing in disordered eating. And specifically, we're going to talk about weight loss surgery clients that she deals with often. So tell me a little bit about what you do, Catherine.
Well, a lot of times I have clients that come into me after they've had the surgery when they're having a few complications. And so they're really looking to help navigate kind of what life is after surgery, kind of after the weight loss has happened and the life gets back to a little bit normalized. So typically what happens is a couple of years after surgery, people start to get back to some of the old habits. Sometimes the weight slowly starts creeping back on. And if you don't really find a good, healthy outlet to handle some of your stress and emotions, sometimes people start turning back to food. If you're missing your grandfather or want some family time, you know, no amount of food's ever going to fill that.
Right.
Have the surgery, a lot of times they're thinking, you know what, my hunger's going to go away.
Yeah.
And initially it does. And after typically about 1.5 to 2 years, I have people report, you know what, the hunger didn't go away. And, you know, initially I was more motivated to lose weight and I was kind of following the plan specifically, but now it's a little bit harder. And so what's important is that you find a healthy outlet. So sometimes people come in and have switched addictions. So I've seen alcohol, drugs, shopping, gambling. And so it's more important to look at things like journaling, talking to a friend, doing some meditation, some other outlets that aren't going to cause you more problems.
Right. So if you were to advise somebody, maybe somebody's thinking about having weight loss surgery, what 3 things would you make sure that they knew before having the surgery?
The first thing is that it's just a tool.
Yes.
That it's really important to learn hunger and fullness cues and to learn about intuitive eating. Intuitive eating is eating according to your hunger and fullness cues. So really recognizing when you're physically hungry and eating until you're no longer physically hungry. So not eating outside of hunger cues. And, you know, the surgery just helps with some hunger cues, but if you're eating outside of hunger and you're eating for emotional reasons, surgery's not going to help you at all. You know, and that's a lot of people do struggle with emotional eating. The second thing is that vitamin supplementation. Your vitamin and minerals are going to be, your need is going to be a lot different. The surgery, most of them will alter your nutrient needs and how you're able to absorb them. So it's lifelong supplementation. And I find that a lot of people, they start and do real well in the beginning, and then they're not as good, not as faithful as taking them. And the deficiencies that you could get could cause you a lot more mental and physical problems.
Okay.
And then the third thing is that ultimately the goal is to get you to normalized eating. So it's not that you're always going to focus on having protein and that, you know, you eat just protein and vegetables and you stay away from, say, carbohydrates. A lot of people get afraid. That's a big thing that I see, is that they're afraid of certain foods because they're afraid they're going to gain their weight back. And really it's about learning how to eat all different types of foods. I mean, my motto is there's always room for ice cream and chocolate. And I truly do believe there is always room for ice cream and chocolate.
Just not all the time.
Just not all the time, right? Not be able to have the whole cake or the whole gallon of ice cream, but most of the time you're able to incorporate most of those treats in. And people are coming in and the food just, they say it gets stuck and they've got to get it out. And so then they think, well, I just ate too much food or I ate the wrong thing. A lot of times what it is they haven't eaten slow, or they ate too much, or they didn't chew enough. And these are all skills that if you're considering having a surgery, that it's really important that you get a good handle on early, and it's important to practice long term. Matter of fact, it's not even for somebody who's had weight loss surgery. We all should be eating like that.
Definitely.
You know?
Yeah.
So.
Slow eating.
Yes.
Yeah. Great information. Thank you so much. Again, Catherine Fink, website is dietitianadvice.com. She's in Irving, Texas. Thanks so much, Catherine. So good to see you.
Thank you.
Appreciate having you here. Thanks for watching Neily on Nutrition, and we'll see you in the next video.